Hello, my name is Scarlett Lorenzo. English verb tenses in medical context, CR4 B2. Number 1, present simple. Us, fact, facts, routines, general medical drugs. Affirmative. Doctors prescribe antibiotics for bacterial infections. Negative. Doctors do not prescribe antibiotics for viral infections. Interrogative. Do nurses monitor vital signs every shift? Answer: yes, they do. Number 2, present continuous. Us, actions happening now or temporary medical situations. Affirmative. The patient is receiving intravenous fluids. Negative. The patient is not responding on the treatment. Interrogative. Is the surgeon performing the procedure right now? Answer: yes, she is. 3. Present perfect. Us. Past action with present relate. Medical history results. Affirmative. The patient has developed post-operative complications. Negative. The patient has not shown any adverse reactions. Interrogative. Has the lab confirmed the diagnosis? Answer: yes, it has. 4. Present perfect continuous. Use actions that started in the past and continue now. Symptoms, treatments. Affirmative. The patient has been experiencing chest pain for 2 days. Negative. The patient has not been taking the medication regularly. Interrogative. Has the patient been following the prescribed diet? Answer: yes, he has. Past simple. Us. Complete action in the past. Affirmative. The psychosis diagnosed hypertension last year. Negative. The nurse did not administer the wrong dosage. Interrogative. Did the patient attend the follow-up appointment? Answer: yes, he did. Past continuous. Us. Action in progress at a specific time in the past. Affirmative. The medical terms was monitoring the patient during surgery. Negative. The patient was not sleeping when the symptoms appeared. Interrogative. Was the patient bleeding during the procedure? Answer: no, he wasn't. Past perfect. Us. An action completed before another past action. Affirmative. The patient had completed shine therapy before the release. Negative. The doctor had not reviewed the test results before discharge. Interrogative. Had the patient received the vaccine before exposure? Answer: yes, he had. Past perfect continuous. Us. Duration of an action before another past event. Affirmative. The patient had been complaining of dizziness for a week. Negative. She had not been taking insulin properly. Interrogative. Had the patient been fasting before the flow test? Answer: yes, she had. Future simple will. Us. Decisions, predictions, promise in medical care. Affirmative. The doctor will adjust the treatment plan. Negative. The medication will not interfere with other drugs. Interrogative. Will the patient recover fully? Answer: yes, he will. Future with going to us. Plain medical actions, evidence based predictions. Affirmative. The patient is going to under surgery tomorrow. Negative. She is not going to continue the current therapy. Interrogative. Is the hospital going to implement new safe protocols? Answer. Yes, it is. Future continuous. Us. Action that will be in progress at a future time. Affirmative. The medical terms will be monitoring the patient overnight. Negative. The nurse will not be administering medication during the scan. Interrogative. Will the patient be staying in intensive care? Answer. Yes, he will. Future perfect. Us. Action complete before a future point in time. Affirmative. The patient will have complete rehabilitation by June. Negative. The doctor will not have finalized the report by tomorrow. Interrogative. Will the lab have released their results by now? Answer. Yes, it will. And 13. Modal verbs, medical context bonus. Us. Obligation, possibility, advice. Affirmative. Patients must follow post-operative instruction. Negative. The patient should not discontinue the medication abruptly. Interrogative. Can this condition be treated without surgery? Answer. Yes, it can. Hello, my name is Scarlett Lorenzo. Continuous. English verb tenses medical context B2. Part 1. Multiple choice. 25 items. Choose the correct answer. Number 1. The nurse usually monitors vital signs every 4 hours. 2. The patient has experienced chest pain signs early this morning. The doctor had confirmed the diagnosis before the patient arrived. The patient was taking medication when the allergic reaction started. 5. The surgeon will perform the operation tomorrow morning. The patient hasn't shown any improvement so far. 7. The lab results will have been released by the end of the day. The patient was staying in intensive care when complications occurred. The doctor will change the treatment plan if symptoms worsen. The patient had been taking medication regularly before hospitalization. The nurse hasn't given the injection yet. The patient was taking painkillers while waiting for surgery. The hospital will implement new safety protocols next month. The patient had been reporting symptoms for several weeks before diagnosis. The doctor is reviewing the test results at this moment. The patient will be discharged unstable. The nurse checks the dosage before administering the drug. The patient will have had surgery by the end of the week. The doctor doesn't prescribe antibiotics for viral infections. The patient had taken blood tests when the doctor arrived. The surgeon has been performing the procedure for 3 hours. The patient has experienced allergic reaction in the past. The nurse was cleaning the wound when infection was detected. The patient will have been fully recovered by next appointment. And 25, the doctor monitors the patient's condition carefully every day. Part 2, fill in the blank. 25 items. Number 1, the nurse checks the patient's blood pressure every shift. The patient has been experiencing nausea since the morning. The doctor reviews the test results before surgery. 4. The patient is receiving treatment at the moment. The surgeon performed the operation yesterday. The patient has not been taking the medication regularly. The hospital will implement the new regulations next year. The patient was waiting in the emergency room when symptoms were seen. 9. The nurse has already administered the injection already. The doctor will adjust the dosage if necessary. The patient will be discharged tomorrow. The lab has been analyzed the samples all morning. The patient has been suffering from headaches for a week. The nurse monitored the patient during surgery. The doctor has not finished the report yet. The patient will have recovered by the next follow-up visit. The surgeon had completed the procedure before complications arose. The patient did not feel pain during the procedure. The nurse was preparing the, the equipment when the doctor arrived. The patient has been taking insulin for several years. 21. The doctor is explaining the risk at this moment. The patient had blood tests early today. 23. The hospital has upgraded its facilities recently. The patient will be monitored overnight. And 25. The doctor prescribes antibiotics only when necessary.